A highly addictive drug is destroying West Africa's youth. It's called Kush. In Sierra Leone, President Julius Maada Bio has declared a national emergency on drug abuse, responding to a drastic increase in the use of Kush. Kush is a synthetic drug with devastating effects. It's caused hundreds of deaths, as well as major psychiatric damage to some users, and its main victims are young Sierra Leoneans.
A few puffs, and Kush catapults the user into a trance-like state. Once high, they sway their bodies back and forth, appearing zombie-like and drowsy. At about 25 US cents a dose, Kush is a relatively cheap and easy way to escape reality. But the kick only lasts for an hour. Then they need to buy more. Dependency is destroying the lives of many young Sierra Leoneans.
They say I have to purge my body of this substance. Since I started smoking 5 years ago, my body is now addicted to this thing. I have to buy medication, but I don't have the ability to wean myself off it, so it's difficult.
Ibrahim Koroma is a social worker. He often visits Kush user hideouts like this one in Freetown. Though there are no statistics on Kush addiction, he believes it's the most urgent issue that government needs to deal with.
Young people are dying. Young people are dying. We need a speedy and refocused strategy to see how young people are taken from this drug intake. But at the moment, it is quite alarming.
Sierra Leone's only psychiatric hospital is overwhelmed with Kush addicts. More than half of those admitted are users. But staff say these are the worst cases and only the tip of the iceberg.
If you go down to the parks, you go down to the streets, you go down to the ghettos, you'll find much more, people using these substances and the impact has been created on them than what we see here.
With Kush addiction rapidly on the rise, Sierra Leone's president has declared a national substance abuse emergency and set up a special task force.
We are making concerted efforts to combat this menace. But unfortunately, we are experiencing a surge in Kush consumption and escalating fatalities.
It's clear that Kush is highly addictive and destructive. What's less clear is where it comes from or where it's going. Reports say it is already destroying lives in neighboring countries like Guinea and Liberia.
Now, Kush is not just a problem for Sierra Leone, but also some neighboring countries. Back in January, Liberia's new president, Joseph Boakai, used his first State of the Nation address to declare the use of Kush a public health emergency and an existential threat for the country. Now, my colleague Edith Kimani traveled to Monrovia not too long ago to find out more about the challenge there, and she joins us now from Nairobi. Hi, Edith. Can you tell us about what you witnessed in Liberia?
Well, as soon as we got to Monrovia, one of the first things people kept telling us is you have to talk about this problem of Kush. But the challenge is that we couldn't see the challenge. We couldn't see the problem. Here and there, we would see people nodding off, as it's called, when you're completely zoned out. But it didn't really reflect what people were saying. It's only until we went to what's called a trap house, an abandoned building where people take drugs, that we really got to see what the challenge was. And so this is a report that we filed as part of the 77%, which is DW's Africa flagship program.
The truth is that there is a drug here which has ravaged some of its youth. Kush. It's a synthetic drug whose true origin and composition is still not fully understood, but it's become a fast popular drug for disillusioned youth who have nothing to look forward to. And so we're going to speak to some of them to understand why they're in this trade and what it means for society. I'm told these ruins house at least 300 people. Almost everyone here smokes Kush. For about 4 years now, it's been severely affecting Liberia's youth population. It's hard to put into words what I'm witnessing because it's not anything that I've ever experienced before. Every room that you walk into has people without hopes and dreams and ambitions, and they're prisoners of their own reality. Kush, like crack, delivers a brief yet powerful high when smoked. The sensation quickly fades, leaving the user in a kind of hole. I meet William Cooper, who is smoking a single pellet of Kush for 50 cents.
Yeah, so when you take it, sometimes, you know, it make you forget about the past, and make you forget about the war in there and other things that have been bothering you. So when you take this, you relax yourself for some time. When it use you, when it is already bodied completed, where you see all who get back on the street looking for money to get some and then buy some to consume.
The individuals addicted to drugs in this area are referred to as zogos, a term akin to zombies. The ruins also shelter many women. To support their drug habit, some of them engage in commercial sex work. I've seen a few women here who are pregnant. What happens when they give birth?
Some people give birth, sell a child. Some people give birth, leave a child in the hospital and escape.
Is it dangerous here for you as women?
Yes, it's come and go out with you, take the money and beat you.
They will just have you free and run away. They will say they give money and beat you and fuck you and go.
Take the money back.
Has that happened to you?
Yes, it happened to everyone of service.
Yeah. Okay. All right. Thank you.
Okay.
Yeah. The conditions here characterized by rape, drug abuse, violence, and rampant disease are shocking and heartbreaking. People here resort to various means to earn money. Some sell food while others work at the beach pouring concrete. But drug addiction has incapacitated many. Recently, tuberculosis claimed the lives of 2 residents. Amidst this, 2 locals are raising funds to support the affected youth. How did it become such a penetrative drug in Liberia? Why do you think the government has been slow to respond?
I think the reason is that some of those very government officials in government are part of this identical drugs deal. They are part of this identical drugs dealing. There are some members of the House of Parliament are also involved in the drugs dealing. So they will not want to put effort. And the future of Liberia are the youth.
Yeah.
If the youth are perished and they're gone, Liberia is nothing.
Many allege that politicians are benefiting from drug trafficking, a claim we hear from numerous sources and plan to investigate.
So to reunite ourselves, our family, is the most important. If I don't have money now, I cannot go home. Even when I go home, I will be like a laughing tooth. But we are not crazy. No. Okay? So I would really like for that help to come. I should be rehabilitated and empowered.
All right.
So that I can become a help to this nation too, one way or the other.
Thank you, guys. Thank you so much for speaking to me.
Thank you too for
thank you too for the time, the opportunity.
This house and the people in it leave me both stunned and heartbroken. It's a stark reminder of how society can neglect its own. These individuals cannot overcome their challenges without support.
What a chilling and sad watch there. Edith, did you get a sense of why these people, these young people, are getting into these drugs?
Well, obviously, there's an individual story for every individual user, but the general consensus is that a lot of these young men and women were born into war, a time when Liberia was really eating itself, come out of that into an Ebola pandemic, and after that, COVID-19. And so it's been disaster after disaster for each and every step of their lives. And so it's no surprise that a lot of them, most of them orphaned, are turning to drugs. And with no support from government, it's no surprise that some of them have been in that house called Zimbabwe for years.
You've done a lot of reporting, in various countries, but what impression did this one leave on you?
I can tell you that these are images that I won't be forgetting for a long time. When we were done filming, I turned around and there was a young man. I eventually learned that he's just 20 years old. And he looked at me with such desperation and with a soft voice just said, "Please help us before it's too late." And I thought, he's so desperate and he's just 20 years old. And I just didn't see a way out for him at such a young age. And I could really relate to him because, you know, I'm not much older than him. And to imagine a world where you're trapped before you even have a chance to fulfill your potential just left me feeling very, very, very dejected.
Edith Kimani in DW studio in Nairobi. We appreciate your reporting. Thank you. Let's speak now to Prince Bull-Luseni, Executive Director of the West Africa Drug Policy Network, joining us from Accra. Welcome to DW News Africa. Now, is it clear to you what this drug Kush is made of?
Yeah, thank you for getting me on air. It's absolutely unclear. I mean, there are rumors about the composition of the drugs. I've held the drug myself. It's what looks like cannabis, but a little bit more different. But of course, there are rumors about the content of the substance that has tramadol, it has formalin. In the case of Sierra Leone, we hear it has human bones. But then I think there's a need for an advanced analysis of the substance, as it may vary from one country to another.
So we haven't got to that stage of properly even studying it, but do we know more about where it comes from or who produces it?
The source of this drug is still unclear, right? So depending on who you talk to or where you find yourself, I mean, there are claims that there are precursors brought together by different producers. We are yet to really find out the origin of the drug itself.
So we're not sure as to whether it's come from abroad or whether it's produced locally or how it's trafficked compared to other drugs?
It's unclear. It's unclear.
Right. Just based on your studies and your observation of this, do governments, for example, in Sierra Leone or Liberia have or even elsewhere in West Africa or Africa where it's where you have this problem, do these governments seem to have a viable plan to address this specific issue any differently from how they've approached drugs in the past?
Respectfully, I would say no. I mean, they haven't approached drug any differently in the past. I mean, as we speak, most of the laws in the region or in the sub-region are all prohibitive. They're enforcement-led. And my organization, the West Africa Drug Policy Network, and other advocates have been asking for an evidence-based drug law reform. It's an approach that is based on human rights and public health. It is good that the governments in Liberia and Sierra Leone are thinking about a public health approach. But yet the laws, the legislation remains punitive. And even the approach they're currently using, I guess, is also a scare tactics. It's also punitive. The blame is always on the victim, people who use drugs. So with the declaration of a state of emergency on drug abuse, I am hoping that these governments, in the formation of their task forces, will consider a public health approach rather than a criminal justice approach. I mean, that means we should have an alternative to incarceration, to punishment for drug use. But as it stands right now, what I see in Liberia and what I'm seeing in Sierra Leone, it doesn't look like an absolute alternative to criminal justice. Or even if it's a public health approach, there are no clear steps as in how this will be addressed. Unlike the Gambia, they are using a model that is a public health approach. They are creating testings, they are making provisions for harm reduction, and also analysis of the substance itself so they can have a proper intervention.
What makes this in particular such a difficult drug and surrounding phenomenon to tackle?
And particularly because the content, the major ingredients of this substance is unknown. I think that's one major problem. And so it makes it difficult. So if you want to treat or you want to address the problem, so you might be addressing addiction, for instance, and there are other issues, there are other health-related issues that you also have to address. So, for example, even if a user or a dependent or a problematic user stops taking the drug, they would have other health-related issues that you would have to deal with. They will also have other social problems that you would have to deal with. So, and the speed at which it's destroying lives and the health, is beyond measure. So it's in a fast-paced, destructive substance that would really need an administration that has substance use on its political agenda to be able to address it.
Okay, we'll have to leave the conversation there, but Prince Bull-Luseni from the West Africa Drug Policy Network, thank you very much for speaking to us.
You're most welcome. Thank you for having me.